In Belize, World Pediatric Project partners with community health workers in a national clubfoot casting program to give Belizean children born with clubfoot an effective non-surgical option for care. This ensures that they can go on to live full and productive lives, free of pain and disability.
Give every child with clubfoot a normal life. We don't want the child to grow up and be in a wheelchair, unable to walk, unable to move around, unable to function as a normal child. It's not any specific thing that causes clubfoot, and that's the thing that we need to explain to parents. It's not your fault. It's not something that you did anything wrong, or it's just something that occurs. And it's important to know that it's likely to happen more in boys than in girls.
There are currently about 4 children in the program, but since it was established over 12 years ago, some 50 persons have received treatment through the program.
World Pediatric Project has an ongoing clubfoot program, and I think that it's important for us to spread awareness about that, because a lot of the times people would think that this is something that cannot be corrected, or it's something that requires a surgery, which is not necessarily so, because we have a 2-phase program, which is the casting and the bracing. We have about 4 kids right now that's doing casting and bracing. So it's free of cost. We coordinate everything for them in terms of the treatment. We fund for the materials. We get all of the materials in. And we also have trained casters in the country that can do the casting.
With COVID-19, the service providers have had to get creative. Program manager Candice Tillett of World Pediatric Project explains the corrective process.
You would see that the child's ankle is like bent in, so that the child is unable to walk. And a lot of the times this can be corrected with just serial casting, which means that the patient would do like about 6 castings every week. The foot is placed into the corrected position little by little every week. And then after the casting, then there's a bracing phase where the child needs to use the braces for at least, I would say, up to 2 years. I would say at least 85% of cases can be corrected by serial casting and effective brace wearing. They have to use the braces for 23 hours a day. They take it off for 1 hour when they're showering, but they have to put it on back.
Duane, Moody for News 5.